like some people are actually charging people ridiculous amount, like pay £200, pay £100, so that we can sort out your care certificate. Guys, don't pay anybody anything. Hi guys, how are you all doing? Welcome back to the channel. If you're watching one of my videos for the first time, my name is Atineke, and on this channel I basically share bits about lifestyle, career, motherhood, my immigration journey, and the tips and hacks that have helped me along the way that I feel will be useful to people. So yeah, basically that's what I share on this channel. So welcome. So today I'll just get right on with it because I think it will be a long one. I'm not sure yet, but we'll just see how it goes. Today I will be giving you guys the full gist about the health and care visa. So this video is basically about relocation to the UK as a carer, even if you don't have any healthcare qualifications and you don't have any experience. Now, I've heard a lot and I've really seen a lot about this particular visa, and most of it has been quite confusing. Like I have like friends and family that have sent me like a lot of information, which I've discovered that like most of them are quite wrong. So I've just made my research because I promised you that on this channel I'll be giving you guys the lowdown of everything, all the juicy bits. So I've done the research, and I tell you, I've been sitting on this video for quite a while now because I wanted to be really sure about like the information I'll be giving you guys, so I'm not misleading you. So I've made my research like over like a couple of weeks now, and if I'm telling you something now, trust me, it is the real deal. So yeah, let's just jump right into the video. Now, what is this visa about? So in 2020, I think August 2020, the UK launched a new health and care visa. Now this visa is part of the tier 2 general visa, which is the skilled workers visa that nurses and doctors get when they're coming into the UK. Now for the health and care visa, it basically is a type of visa that is sort of like a fast track visa. So you get it quicker. I mean, they aim to process this visa within 3 weeks. And it's also like a reduced charge, so you'll be paying about £230 for up to 3 years and about 400 and something pounds for up to 5. So yeah, for more than 3 years. Sorry. So for this particular visa, also you won't be paying the health surcharge, which is really good because I tell you, if you calculate the health surcharge, I can't remember now the exact amount, but you're supposed to pay health surcharge per year. So if you get a 3-year visa, you pay health surcharge for each year times 3. So the good thing about this particular health and care visa is no health surcharge, a reduced amount, and faster processing time. And this is what you get as a carer coming to the UK. Now, I think it was about I'm not so sure now, about last year when they added the senior care assistants to the list of the shortage occupation in the UK, and this was under the code 6146. Now, this is where people have been getting it wrong. I've been seeing like people advertising that, oh yeah, you can come to the UK with no experience, come as a carer and all that, no education, no healthcare qualification needed and all, under the senior care assistant visa. Now, this is not quite true. For you to get a job as a senior care assistant in the UK, you need a level of qualification in health. You need at least NVQ3 in health and social care. So it means you need at least a diploma, which they call A-levels or diploma, in health and social care before you can work as a carer under the senior care assistant role. Now, the one I'm about to tell you guys today will not be under the senior care assistant role. Now, granted, if you have some degree or some diploma in health and social care, and you have like a level of experience, working as a nurse trainee or nurse associate or auxiliary nurse, you can come through the route of the senior care assistant. And if you guys would like me to give you more gist about that, I would make like a totally different video for that, because you know what, each category is a very long thing. But the one I'll be sharing with you guys today is the role of care assistants, carers, nursing assistants, home care assistants, etc. And this has just been introduced, like I think it was 15th of February. It was just added to the shortage occupation code under the code 6145. I said the other was 6146, so this is 6145, and this is where people have been getting it wrong. Now, for the carer role, the care assistant role, you don't need any previous experience. If you have it, it's desirable, but our preferred, like they would say, but it is not compulsory. Also, you don't need previous health qualification, because the truth is that when you come in as a care assistant, most of the job would offer you like a full training under this role. Now, for this health and care visa, it means that you're working either under the NHS, with an NHS supplier, or in the adult care. Now, it has to be a job where your employer has a sponsorship license. So if your employer doesn't have a sponsorship license, then they can't sponsor you to come down. You understand this along the way when I start to explain. Also, another thing to know about this health and care visa is that it works just like the tier 2 visa, in that after 5 years you can apply for the indefinite leave to remain, which means you can apply for permanent residency in the UK, and in the 6th year you can apply as a British citizen. So you can say that it is a very good route to come through. Another thing I would like to mention, about this health and care visa. Sorry, I had to write everything down because it's a lot to talk about. So if you see me just like glancing down, it's because I had to write everything down. Also, under this visa, you can bring in your dependents. So if you're coming in, you can bring in your wife, your husband, or your children, or your partner. So if you have a long-term partner, even if you guys are not married, you can come in with your partner and all. So it has to be like your direct dependent. So it doesn't mean you can come with your mom or your dad. No, it has to be like your husband, your partner, your wife, your children, your direct dependents. Now that we've gotten that out of the way, let's go on to talk about the step-by-step approach, to getting this visa. And while I do this, I'll also tell you the requirements, the things you will need to have before you can get this visa. Now, step 1 is getting your international passport. Now, if you've watched my previous episode where I talked about, getting into the UK as a nurse, which really is the reason why I'm doing this whole video, because I remember when I did that video, so many people were asking me like, TK, why are you not giving us like gist about how to come into the UK as a non-nursing professional? I don't know if that makes sense. Someone that is not a nurse. So why are you not giving us like a gist about that? No. So I said, oh, you don't worry, I've got you guys. So I'll give you guys the gist. Yeah, so that's why I'm making this video. Do you know what? I noticed I'm digressing a lot. Let's get on to the step-by-step approach. And the first thing, like I said, get your international passport. That is the way for you to identify yourself, booking your exams and all that. Now, the second step really depends on you. You can either decide to take your English test first or start looking for a job first. And the truth is, you can actually start doing both concurrently. Now, let's start with the English test. To come into the UK, to work generally, to get a work visa in the UK, they need to know that you have a particular English proficiency. It just means that you can literally speak and you can listen, you can speak and you can understand English language. And by this, they want you to have a test done. Now, I know this test does not apply to some particular countries, I think those outside the EU, those in the EU and co. But for countries outside the EU, EEA area, you would need the English test. Now, what score do you need for that? So, to start with, the English test you will need is the IELTS UKVI. And I say UKVI because once you have that, then you can just use that to process your visa and, your visa application and all. So just book the IELTS UKVI instead of the ordinary IELTS. Now, you need the IELTS UKVI and you need a minimum score of 5. Now, I've seen some sites where they ask for a minimum score of 4. I've seen some places where they ask a minimum score of 4.5. But I've also seen some places where they ask for a minimum score of 5. So I think 5 is just like the band you should aim for. And, if you ask for 4, then all well and good. At least you have more than 4. You don't want to aim for 4 and then most of the jobs you get will be asking you for 5. So aim for 5.0 in all the sections as speaking, listening, reading and writing. If you watch my previous video, I have also listed, I've talked in details about IELTS, the types and all that. So just know that for this health and care visa, you need a minimum score of 5. Now, that's the second bit. The other part is where I talked about finding a job. Now, this is the big part. Because the truth is, unlike a nursing career where when you're coming here, you have to write a particular number of exams back in your country. You have to come here and do some exams. For the carer visa, the care assistant visa, you don't need to write any exam per se aside your English proficiency exam, which is the IELTS. So you have the time to start searching for a job. And the truth is that when you get a job, everything will happen really fast. So try and invest your time in searching for a job. This whole, getting a job thing under the health and care visa became really popular earlier this year. So people have been sending broadcasts and, talking about it and all that. So it is quite hard finding a job out there. So you have to be really determined, send out loads of and when I say loads of applications, I'm talking like send out like 30 applications, 40, 50 applications to different care homes. Now, most of the institutions, sponsoring people in are majorly care homes and agencies. So try and target those. Now, I'll put some link in the description box of sites where you can, you can utilize to search for a job and be able to get like companies and care homes that would sponsor you. The popular ones are Indeed.com, TotalJobs, Read.com. But like I said, I'll put a link in the description box, and then you can use this to search for a job. But basically, if you just go onto Google and type in care assistant job with visa sponsorship, you'd see like loads of them. All you just need to do is get your CV and start applying. Now, have your CV already tuned to like a healthcare, how do I say that, healthcare way. So in this video I won't be going into details of how to like sort your CV out and all, but all you need to know is that you should get your CV sorted so that it shows that you're interested in healthcare. Like I said, you do not need the experience, but if you've cared for someone before, maybe like your grandma or like a family member or someone, you can also put this in your CV. It just shows that you have a passion for care and all. Basically, all that matters is you being able to convince your employer during the interview that you really have the passion for caring and you're able to do the job. When you come to the UK, they will give you a full training. Now, another misconception I need to correct in this video is I've been seeing a lot of companies, especially in Nigeria, saying, oh yeah, they would give you like, they'll provide you the care certificate before you come in and all. That is not true. And why do I say that is not true is you need to be in the UK to get a care certificate. Now, this care certificate is in two parts. Granted, you can do the theoretical part while you're in Nigeria or in whichever country you're in. The practical bit, you actually need to be in the UK and you need to have like an assessor look at you work. They need to see you working, caring for patients and all that, and assess you and see that you're qualified to have the care certificate. So there's no way you can be in your country outside the UK and get the full care certificate. So I needed to say that because I've been seeing a lot about that too. And they're like, some people are actually charging people ridiculous amount, like pay £200, pay £100, so that we can sort out your care certificate. Guys, don't pay anybody anything. Just go through all the videos step by step and you'll be able to figure this thing out yourself and just sort yourself out instead of wasting your money. Anywho, let's continue. So I'll just do a quick recap. Get your international passports, do your IELTS, get the minimum of 5.0 for your speaking, listening, writing and reading, and start searching for a job. Now, I will give you more details about searching for a job because the truth is that that's the major part of this whole coming to the UK as a care assistant process. So what are the requirements that you need to be looking out for when you're searching for a job as per gov.uk? Now, I just need to quickly check this because I know I wrote this down. Now, the first thing is your pay, the salary. The government has stipulated that for you to be qualified for the health and care visa as a care assistant, the going rate, it should be nothing less than £20,480 annually, or £10 10p per hour. Now here they pay you per hour and you can also calculate your annual rate from that. So whatever job you're getting, when you're negotiating and all, I think most care homes know that, but you also need to know so you don't get you don't negotiate for anything less or you don't get anything less because you won't qualify for the visa. So you need to know that the salary is £20,480 per year and then £10 10p per hour. Now that's the first requirement to get this visa. The second one is that your employer has to be a licensed sponsor. So it basically means that they have to like pay the government a certain amount to get their sponsorship license to be able to sponsor your certificate of sponsorship. Now that's the second thing. The third thing is getting a certificate of sponsorship, which I just mentioned now. So for the certificate of sponsorship, it's basically a certifying document that your employer is the one bringing you in from whatever country you're coming from and into the UK. So it's an electronic document where they generate a number, and then you're able to use this number to apply for your visa. So you need to get a certificate of sponsorship to actually be able to apply for your visa. The next thing is the financial requirements. Now, if your sponsorship doesn't include, if your employer doesn't say that he or she will sponsor you for the first month while you get your bearings, then you have to have cash in your accounts. Now, if your employer includes in your certificate of sponsorship that he or she is willing to sponsor you for the first month, then you would not need any financial, when they say, oh yeah, bring your bank statement for visa and all that. Once your COS states your employer is going to foot you for 1 month, you don't need any bank records. However, if your COS does not state this, then you need £1,270 per person in your account. So if you're applying for just yourself, you need 1,270 in your account. If you're applying for yourself and your dependents, you need that amount times the number of people you're applying for. So most times you're able to negotiate with your employer, and most of them would actually state in the certificate of sponsorship that they are willing to foot your bills for the first month. Now, this doesn't necessarily mean they are going to actually foot your bill. It just means that they are willing to help you out, in case you're stranded or in a jam. I mean, I remember when I came in as a nurse, my COS stated that they were willing to foot me for the first month. And in the actual sense, when I came in, they approved my accommodation for the first month, and they just helped us generally to get settled in that first month. Helped us with bank account opening, gave us a particular amount to help ourselves, in case you didn't bring any money when you came in. Yeah, so generally, things like that. So if your COS states that they would foot you for 1 month, then you're good. So I'll leave the link in my description box to this gov.uk site where you can get more information, about the requirements for this visa. But just know that your salary has to be up to 20,480 or £10.10 per hour. You have to have the English language proficiency test on lockdown. You have to have your COS sorted by your employer. Now, once you have all this sorted, your employer you would have done your interview and everything, which I don't know if I said anything about that. Your employer will sort out your interview, which obviously if you are getting a job, you do the interview, and your employer will sort all these things out for you. Once you have all these things sorted, you're able to apply for your visa. Now, to apply for the visa, there are just a couple of things extra that you would need, which are the tuberculosis tests, which you can have done in any of your own country. Say, for example, Nigeria, where I'm from. You can have the TB test done in Lagos, in Abuja, all the major cities. You need that. You also need your police clearance, which you can get done at a police station near you. So if you go to all those police headquarters around you, I can't remember where I did mine back then in Lagos. I think it was somewhere around Ikoyi. Yeah. So wherever you are, whatever country you are applying from, just try and get your police clearance sorted. So you will need all this to apply for the visa. And once you've applied for the visa, I said earlier that you'll be paying about £232. Once you apply for the visa, you're literally just waiting, keep your fingers crossed, waiting for your visa to come out. When your visa is out, you get to relocate to the UK. And yes, so that's basically everything that you would need for the health and care visa. Now, I can just do a quick recap so that you have like a chronological order of everything. The first thing, get your international passport. The second thing is write your IELTS UKVI and get a minimum of 5.0. The third thing is get a job. Now, the job you're getting has to be a salary of £20,480 annually or £10.10 per hour. Your job has to sponsor your COS so that you can apply for your visa. And your job has to state on your COS that they are going to sponsor you, for the first month, or you have the cash equivalent for that. Once you have all this sorted, you're able to apply for your visa and come to the UK. So I hope this has been helpful. Now, I know there are some bits that I had to cut short, because if I had to go deep into how to get a job or how to write your IELTS, it would be a very long video. However, if you have any question about everything I've said, or everything or anything I've said, just drop it in the comments box and I'll be happy to provide a response to that. And if you need me to do any other video to clarify any of the things I've mentioned earlier, just let me know. I just thought to give you guys a quick recap, because I've really seen a lot of misconception about this particular visa, but you need to know it's different. For one, you need experience, you need healthcare qualification. For the other, you don't need this. Oh, another thing I need to mention is this. if you have a driving license in Nigeria or whatever country you're applying from, it would be really helpful. Now, it might not be compulsory, but I've noticed that about 60 to 70% of the employers ask for this. And it's easy. If you have a driving license and you're actually driving your own country, just try and get an international license before traveling down here. That way, it's easier for you to get a car, and some of them would actually provide you a company car, you know. It's just for you to be able to walk around, sorry, I said walk, to drive around, you know, drive to your workplace, because it really depends on the job you get. Some of the jobs will be like going to different people's home to care for them. Some will be, you know, traveling around and all. But yeah, just try and get an international license. It's not compulsory, but it's preferred. So it would give you an edge when you're applying for this job. So that's another helpful thing. I think that's all that I can think of for now. Like I said, if you have any question, let me know. So that's all for today's video. I hope this has been helpful to you guys, and if you think it's been helpful, or you know anyone else that it will be helpful to, please kindly share this video, like this video, drop your comments, and I'm really looking forward to, you know, getting your response about this video, because I have put time and effort into this research. Okay, and don't forget to subscribe, guys. Kindly subscribe once you've watched this video. Thank you. I'll see you guys in another video. Bye bye.